don't know who's on the phone yet.
Can we get a quick roll on the phone, just so we can decide whether we have a quorum, please?
Brian Clemency, good morning. Good afternoon.
Clemency and Toysher, got them.
Tanaka.
K-O-R-A.
Mark Hennigan.
Okay.
We have 5 from Lockport, sir.
Okay.
Donna and Navina.
Naveen Seth, Donna,
Borton.
Borton. All right, we have a quorum.
Mangione.
Mangione, welcome.
Amelia
Ed
Walker.
Majors.
All right.
Ed Majors here.
Hi, Ed.
How are you, Dr. O'Brien?
I'm well, thanks. All right, let's go ahead and get going. First, we have the previous minutes that are available and were sent out in email from the September meeting. If we could get somebody to make a motion to approve or accept those. From Dr. McNamara, second.
Todd Reisner will second.
Todd, thank you. All right, the correspondence log is attached to today's agenda, as well as the correspondence from last month as part of the minutes, so you can review that at your will. Do we have Dr. Bart or Dr. Walters on the phone?
Hey, Mike, Joe Bart, come on.
Hey, Joe, do you have anything from CMAC?
I missed the last CMAC meeting, but I will be going in January or December, so
Roger.
I don't have anything to report back.
Very good. All right, Chairman's report. I don't have anything particularly long. There were a couple of interim approvals that'll come up towards the end, and then attached to today's agenda are sort of upcoming collaborative protocol changes. Not the least of which is sort of the elimination/modification of the excited delirium protocol into agitated patient protocols for adults and adolescents. So please take a look at that. It's largely a terminology change. Agencies that are equipped with ketamine and Haldol have those options available to them, and with slight modifications, just in terms of dosing and indications. But those are there. So please take a look at those. They are not in effect yet. But that's what's coming down the pipe. There's also epistaxis for agencies that want to carry oxymetazoline. There's a section now for de-escalation techniques to try to avoid ideally having to go hands-on or maybe having to administer sedation or decrease to a lower level of kind of restraint sedation if you can. Interfacility transport and other things are in there. So please review those so you know what's coming. And that's all I have. So that'll bring us to trauma advisory, and I see Beth in the room.
Mike, real quick on that protocol, particularly the one with that was excited delirium, and the reason for the changes are, so everybody knows, is again largely terminology, but there was some bad press around the word of excited delirium, mostly because the National Board of Psychiatrists got together and said it's not really a diagnosis. So as a conglomerate of symptoms, we didn't want to put our providers in the middle of such discussion, so we just named it for what it was, which is combative patients or agitated patients. The terminology there about the criteria in which we're going to use it is all patient care based. So basically we wanted to get away from anything that suggested that law enforcement told me to do it, that's why I did it, and that we're doing this based off of our need to restrain somebody from self-harm or harm to other individuals so that we can perform an appropriate medical examination, which puts all the onus on the provider. I also wanted to dismiss that there's a rumor that we're going to be getting rid of ketamine, because that kind of followed along with this protocol change, and it's largely untrue.
Thanks, Joe. All right, Beth.
Hello. Sorry I wasn't able to put together a report to email out to everybody, but there will be an RTAC meeting on the 29th at 11:15. Invitations have been sent out. DMAP courses. If anybody is in need of a DMAP course, the University of Rochester has now become an improved court site. They're going to be running multiple virtual or hybrid courses in 2023. So if anybody needs the contact information, please let me know. The STAC did meet last month, and they are reviewing TXA dosing at the request of the CMAC. So more will come down the pipe from that. And other than that, one thing that has come up with a lot of the trauma registrars across the state is they're having some difficulty documenting micromobility devices in the PCRs. So there's like 30 of them out there now, between the electric scooters and skateboards and bikes and the variety of different things. So if everybody can just be as clear in your documentation, even if you throw it in your narrative section, that would really help us in documenting. It's a bigger problem downstate. They're about 3 years ahead of us in the volume, but we're now starting to see it here. But we're trying to trend and track which devices are the biggest problems, but everybody's kind of coding them as the same thing. So,
Got it.
thank you.
Thank you. We don't have a nurse advisory committee rep, so that brings us to program agencies. STEMS.
Hi, this is Alicia. My report was included with Karen's email today. Just a few things to highlight. We held some CMEs in our area since the last meeting. We held an orthopedic trauma meeting and a stroke education CME, as well as a roundtable with the new leadership at Olean General Hospital. And then upcoming, we have our paramedic programs going to be starting in January. We've had a lot of interest for this, so we're excited for the next cohort of that. We will be holding another EMTB Academy due to some funding that we have, and that will be likely in the spring or summer. And then we are holding a behavioral health and substance use disorder considerations for EMS training. That's Ben's initiative, and we are being a host for that, and that will be on November 30th. So if anyone wants to come to that 8-hour class and get 8 hours of CME credit, it is here at Sticks and Olean on November 30th, and they can contact me to sign up. That's the end of my report.
Thanks, Alicia. All right, so UVMD, which now includes Big Lakes. Rob.
So like Alicia, my report was included in with the email that went out with Karen. The few things I want to highlight, in addition to the collaborative protocol changes, one big change that's coming down is as of January 1st of 2023, AEMTs will no longer have the ability to orally intubate. They're only moving strictly to supraglottics. In addition to that, if you are running a course for advance, after December 1st, they will not have to test out on that particular skill station going forward. So keep that in mind, pass it around. Just know that as of January 1st, that's being removed from the protocols. We're hoping to have a decision on the new associate director position for Big Lakes soon. We're working to hopefully wrap that up shortly. And other than that, the only other thing is as we don't really have a pathway for this, is Grand Island's requesting the use of TXA, and they've submitted a letter for such from their medical director.
Okay.
So that's all. Yeah.
Thank you, sir. All right, that's it for program agencies. Moving on to subcommittee reports. Dr. Bart, did you have anything else for collaboratives, or did I sort of jump the shark?
No, that was pretty much it.
All right, thanks. QAC committee, Drs. Borton and Tanaka are both on.
Nothing new for this month.
Thank you. Dr. Bart, do you want to talk about bylaws?
I knew you would ask that.
It's written on the piece of
when
paper.
did I start that committee, Ron? Like, when did I start that committee? About 2017?
Something close to that.
Yeah, so I thought that I finalized those things and sent them along, and I wasn't able to accompany them. So I do have that, but I thought it was not a good thing to send it to you 15 minutes ago.
Sure.
So there were we were just working on some bylaw changes to update them for things that no longer make any sense, and frankly, I think we were mostly doing this to try to be a little more inclusive on our membership,
Yeah.
where it was previously, so I can just refresh everybody because the discussion was probably a very long time ago. The discussion, as I recall, was based off of currently our member representation was by hospital representation. And where I thought we could be a little more broad on that is to inviting EMS medical directors, if they are simply approved in the area and they're an agency director anywhere within our territory. So that was going to be the recommendation. That is what I have written down. I just don't have it there for you to disseminate, and that's my apology on that one. I have dropped the ball, sir.
No worries, no worries. Maybe we can send that out. And
But that's at least for discussion.
Yeah, I mean,
Yeah, that's at least the discussion point here. And we're not trying to get rid of positions. We're trying to get more positions. I know we previously had some at-large things, but as EMS, at least from our perspective from the original discussion, it tends to lean more towards agency needs. That it does necessarily hospital needs, but we need both representation. So both of that was cool with me, but we're just trying to scoop up any additional medical directors out there who were not part of their hospital representation, but certainly represent constituent agencies and many times several providers out there.
right, agreed. And plus, I mean, we're by the bylaws, we're required to review them every 2 years, and I'm pretty sure we haven't done that. So this can kind of fill in for that as well. So if we could, we'll send that
That's
out.
what I was waiting for. Yeah.
Yeah. See, we could
Yeah,
send.
I was waiting for that. I wanted to timeline it for you, like
Perfect.
2 birds, 1 stone.
That's awesome.
Thanks.
So maybe we'll send that out, and then we can plan to have an in earnest discussion and maybe even a vote if we're at that part at the January meeting, and start off 2023 having reviewed our bylaws. All right. Thank you, Dr. Bart. Moving on to new business. Rob, did you want to talk about the collaborative update at all, or your name's next to it, so I'm asking.
He's the one that gave it to me. That's
Okay, cool. So that'll move us on to current approvals and notifications. Med director change to Dr. Ryder for Friendship Ambulance Squad. Big tree from Dr. Clemency to Dr. Mangione. Level of care change from paramedic to basic for Frewsburg. Epi syringe notification from Westfield. And that, I believe, is it. Yep. So if somebody would make a motion to approve those en masse or move to discuss one of them.
Moved, Cosgrove.
Josette on mass.
Cosgrove, McNamara, and Josette en masse. Done. Any opposition?
Hey, Mike.
Yes, sir.
Hey, it's Borton.
Hey.
Do you know what Monroe Ambulance took over for COVA in Orleans County?
At the moment, it's a little bit fractured, and I don't know that a final decision has been made, but I know that Mercy has been involved in some of that discussion as well.
Okay, so they didn't submit any change or anything at this point?
Not that I got, and Karen's shaking her head no, so the answer must be no.
Okay, thank you.
Yes, sir. All right. Any opposition to these approvals en masse? All right, I'm going to take that as unanimous consent. They are all approved. Any other new business before the REMAC before we end for 2022? I love fast meetings. Any motions to adjourn?
Seth, motion.
All right, we got Dr. Farney in person, Dr. Seth, and I heard somebody else, which is more than enough for me. We are adjourned for 2022. Thank you all for what you do. Thanks to Twin City for hosting us again, and we will see you in 2023 on January 18th. Everyone have safe and happy holidays.
Happy holidays. Happy Thanksgiving, everyone.
Thanks, everybody.